Should women breastfeed or not? Breastfeeding hurts, but not breastfeeding hurts worse. Research suggests that breastfeeding is healthier for babies than formula feeding, while it creates a stronger bond between mother and child. In this presentation, I will try to convince you of why breastfeeding is vital and necessary. Research suggests that breastfeeding is better for babies than formula feeding because it contributes to a healthier life. In today's society, it is very common for mothers not to breastfeed because of the difficulty they experience in properly feeding the child, along with the pain and discomfort associated with breastfeeding. For this reason, as well as societal pressures, mothers turn to formula feeding. Many women choose and find it easier to formula feed since you can quickly make a bottle and feed the baby within minutes. It's a mother's instinct to calm the baby in an irritated state rather than spend time as well as go through pain getting the baby to properly latch on, which can take hours if not days. Ironically, taking the formula feeding route can, in the long run, hurt the baby because research suggests that breastfeeding is better for babies than formula feeding. This is so because breastfeeding has documented contributions to lowering obesity rates, bettering the immune system, and even elevating IQ scores. Babies who are breastfed are better able to fight viruses and illnesses, and now researchers believe they are beginning to understand exactly why and how that illness protection works. Researchers have identified a specific type of protein in breast milk which helps immediately jumpstart a baby's immune system, providing an active protection to the baby. The protein is called soluble CD14, and it works to develop B cells, which are critical in developing antibodies. Studies have shown that a longer duration of breastfeeding has directly linked to a decrease in the risk of being overweight later in life. After a comprehensive study in which exclusively formula-fed babies were compared to exclusively breastfed babies, and it was found that the longer the baby was breastfed, the less percentage risk was for the child being overweight later in life. The study goes on and into specific examples of duration and the correlation of becoming overweight. The longer the mother's breastfed, the better the results were for the child. One example shows that after less than 1 month of exclusively breastfeeding, there was a 4% decrease in the risk of being overweight. These findings strongly support a dose-dependent relation between long duration of breastfeeding and the decrease in risk of being overweight. A study published in the American Journal of Clinical Nutrition involved 11 different studies and 7,000 children showed that breastfed babies tested at 5.2 IQ points higher than formula-fed babies. In this graph here, the graph shows that the duration of breastfeeding is directly linked to the results of IQ improvement ratings. The graph illustrates IQ assessment scores for breastfed and non-breastfed children at 8 and 12 years of age, respectively. First, you can see the visual aid indicates that breastfed children score better than non-breastfed children. The first section here is not breastfed children, and black represents children 8 years of age, and the blue section represents children 12 years of age. Okay, further analysis will tell you that the longer you breastfeed, the better the IQ score will be. So not only does breastfeeding in itself matter, but the length of time you spend doing it also matters. At 4 months or longer of breastfeeding, 8 and 12-year-olds scored 98.89 and 98.82 respectively, compared to 97.46 and 98.05 who are not breastfed. So if you look further, at 4 to 7 months of breastfeeding, 8 and 12-year-olds tested at 102.16 and 100.87 respectively. At more than 8 months of being breastfed, they scored even higher, which is 102.83 and 103.49 respectively. So as you can see, this graph visually illustrates the importance of breastfeeding. Furthermore, breastfeeding increases the bond between mother and child. Research related to this bond between mother and son indicated that extensive mother and infant skin-to-skin contact lasting longer than 20 minutes after birth increases the duration of exclusively breastfeeding. This shows that the mother, after having experienced breastfeeding, that they naturally want to continue it. In conclusion, get your child off to the best footing as early in life as possible. Only if your health is negatively affected should you avoid breastfeeding. Although it may be easier to formula feed your baby, a new mother should carefully consider breastfeeding despite the pain and discomfort associated with it. As previously stated, breastfeeding greatly benefits the child not only by increasing their immune system and by protecting the child from the potential of obesity, but also because it may lead to a higher IQ. So therefore, spread the word and help organizations whose aim it is to help promote breastfeeding. Thank you very much. Any questions?
Yes, I have one. How was breastfeeding looked at in earlier years in the scientific community?
That's a good question. As little as 2 generations ago, pediatricians were convinced that a sterile, scientifically formulated product was better than breast milk, than mother's milk. Obviously, that was incorrect. Now, well-trained doctors have biochemical and micronutritional medical data to convince anyone that breast milk is much more superior.
Okay, and are there organizations that are designed to help breastfeeding mothers?
Yes, there's definitely organizations out there to help breastfeeding mothers. One is known as the International Lactation Consultant Association, which is a professional association board for consultants and other healthcare pros who care for and assist breastfeeding families, as well as for providing information and helping further research. Any other questions?
No.
Okay, thank you very much. So hopefully I have convinced you that breastfeeding is vital and important in your child's life.